Juice, Dr.
And
Okay. Good.
hello, everyone. It's 7:03. We know we're starting a couple minutes late. We hit a few technical difficulties here. Good evening and welcome to CSOMA's monthly Tuesday night webinar. So we do this the second Tuesday of every month for the entire year of 2026. So glad for you to join us on this really special night where we'll welcome Dr. Toe. We'll get to that in just a minute. Tonight's great webinar. Dr. Toe, thank you so much for being here.
Sure.
Um, so I'm Ra Adcock. I'm the executive director of CSOMA. And while we're getting all our tech together for tonight's presentation, we have a few announcements that are important to make. If you are not following us on Instagram or Facebook, please go there because there's a ton of information about a very heavy legislative season that we're having. There are two bills that we are supporting, and those are making their way nicely through to help solidify acupuncture and Medi-Cal benefits. You can learn more about those on our website. And there is a bill that we had to that we opposed, an education bill that was going to put a lot of strain on our schools at this moment in time. So that bill has been paused. That was AB 2668. However, there is an assembly bill 2497 that is in session right now, is going to be read a week from today, next Tuesday morning in Sacramento, in front of the Business and Professions Committee. And this bill is authored on behalf of the Physical Therapy Association in California. They're seeking to expand their scope of practice to include, as the bill language says, invasive needle procedures. Of course, this is a way of renaming dry needling, which is a way of renaming acupuncture. So we're now 3 degrees separated from the original source. We can't let this happen. We understand that dry needling is a public health concern, first and foremost, because invasive procedures with untrained professionals is not something we can support as a profession, certainly not as a community or organization. We need your help for this. We need calls, we need letters, and it needs to happen. It needs to happen now. It needs to happen before this bill makes its way through the Business and Professions Committee next Tuesday. All of the information is available on the CSOMA website. Sign up for the CSOMA newsletter on the website. If you don't have that, our newsletter gives you instant links and things like that that can make your campaign stronger. And if you're in the Bay Area or in Sacramento, if you've ever wanted to get involved in the legislative process, this is the time to do it. All of our concerns and writings on Facebook and musings through the years about dry needling, it all comes down to next Tuesday in California, whether that bill makes its way through its first reading or not in the B&P committee. So I'm going to put a quick thing into the chat here. You can go here and learn all about this bill and where the location is. The bill will be read sometime after 9 a.m. The address is at this link, and all more details, just keep following along with CSOMA. So we had a town hall about this last week. You can go to, or 2 weeks ago, you can go to our archives and read that town hall and know more what to do there. And just stay moment to moment because we really do have 7 days to urgently continue to call our local assembly members and senators and to call and write to all of the representatives on the Business and Professions Committee that oversees both the Acupuncture Board and the Physical Therapy Board. So thank you for your dedication to patient safety and your willingness to advocate for the highest training standards before any acupuncture needle is ever inserted to a patient, no matter what type of name you want to call it. Okay, with that, I'm going to turn the next part of our program. Oh, by the way, go to our website too to make sure you're signing up for these every Tuesday night. And if you're in Southern California or San Diego or even Central California, you feel like taking a drive, CSOMA is hosting a 2-day super fun symposium at Yosan University, May 1st and May 2nd. That's a Friday and Saturday. You can do 1-day registration in case you'd rather be off on a Friday or be off on a Saturday, or if you want to come and spend both days with us. These bills that we're facing legislatively really highlight how important it is for us to come together in community and to talk and to connect, because our connections are our strength. It's the web of our strength of this medicine, and we need to do that face to face. CSOMA tries to create dinners and conferences and chances for us to come together as a group, as a profession, knowing that so many of us work in standalone sole proprietor clinics that keep us somewhat isolated from the profession. So come on out, anyone that wants to get together in gorgeous Los Angeles at the beautiful campus of Yosan University. We have great exhibitors. We have an amazing program lined up for you. It's all found at CSOMAonline.org. So go there. That's your source. And the person that makes CSOMAonline.org happen is here with us tonight, and that is Kim Newman. And she's going to do her part now. So thanks for being here, Kim.
Thank you, Ra. We have a gold sponsor, Health Concerns, that we want to give a nice shout out to. So I'm going to speak on behalf of Natalie Taylor, and she was unable to make it with us tonight. So she did send us some information that I'm going to share. If possible, Ra or Julie, we could maybe share the website if that's possible, because there's some great information on there. Let's see. So Natalie is a director at Health Concerns. I'm going to speak on her behalf now. We are a Chinese herbal supplement company with over 40 years of history, focused on supporting practitioners and helping expand access to Chinese herbal medicine. At Health Concerns, we've developed over 100 formulas rooted in traditional Chinese medicine, designed to support a wide range of patient needs. For decades, we've been a practitioner-trusted brand, but what's becoming increasingly important to us is not just supporting individual clinics, but helping grow the entire practitioner ecosystem. Because the more patients understand and trust herbal medicine, the more they seek out practitioners, and the more this field can expand. A big part of our focus right now is education on both sides. For practitioners, we're building tools and resources that make it easier to apply Chinese herbal medicine in a modern context through symptom-based guides, simplified formula selection, and ongoing clinical education. And for patients, we're working to make herbal medicine more approachable by translating traditional concepts into language people can understand so that they feel confident engaging with it. We really see our role as a bridge between traditional theory and modern understanding, between practitioners and patients, and ultimately helping grow the entire space together. Our goal is to make Chinese herbal medicine easier to understand, easier to use, and more widely trusted so that more patients benefit and more practitioners can thrive. And before we wrap, we want to sincerely thank Dr. To for his presentation, and for all of you for being here, for your time, your curiosity, and your commitment to learning. And thank you again to CSOMA for creating the platform to bring you this presentation on digestive and gut health.
Thank you, Kim, for speaking on behalf of Natalie and Health Concerns. Thank you, Health Concerns, for being our gold sponsor. We always love collaboration with you. I get the pleasure and honor of introducing Dr. To, is an engineering physician with extensive knowledge and experience in treating complex medical problems, often from untreatable patients dismissed by specialty clinics. His work has revolutionized the application of integrative medicine, Eastern and Western medicine, on both simple and complex medical problems. So Dr. To is going to be talking about reverse engineering metabolic disease. I'm going to share his screen. So take it away, Dr. To.
Great. Thank you, Dr. Olive here. Hi, everyone. Welcome to the presentation. Today, we're just going to do a little discussion about digestive and metabolic health. I emphasize on the reverse engineering part of it is because I do feel that in the modern medicine right now, a lot of the practitioners are focused on finding a diagnosis and treating the problem. What if I tell you for today's presentation is the diagnosis might not be the ultimate goal. So I'm trying to we're trying to get a case, get some understanding of basic fundamental information, and find out how we can reverse the case, look at it differently, and see we have a new insight how to treat medical problems more differently in the different dimensions. So first slide, we just want to kind of welcome everyone. Is kind of give me a little my resume, what I do. So currently I'm practicing holistic medicine in Winter Park, Florida. I've been doing that for 12 years. And previously, I was a Silicon Valley engineer and management over that in San Francisco Bay. So you guys are all familiar with it. And I feel that there is a good marriage between medicines and engineering. So I never dropped my knowledge in about being an engineer. So that's how I formed the practice as is now. And further in the back, I was a chemical engineer degree, graduate from Berkeley and UC Davis, so completely Californian. And I also got a extensive Chinese medicine trainings through apprenticeships, fortunately, in Hong Kong, when I was actually working for a high-tech company, when I take time off in the weekends and nights, just to learn from a couple masters to see how Chinese medicines can inspire me and other people on that. Lastly, my med school is an osteopathic doctor degree in LECOM, Bradenton, in Florida. And I also got training from functional medicines after I finished medical school on that one. We're going to go on the next slide. Okay, so the outline for today, I give you a big topic before, but really I want to kind of get a little touch on what's conventional, what's an engineering approach in medicine. And I'd like to talk about a little bit about embryology and digestive health, and particularly the gut-tube models. It will give us an insight about how we can think things differently. So, and then the other part, how the relations between digestions, emotions, and the chi connections. And then the next slide will be talking about digestion and microbiome connections with prebiotics and other form of factors linked together. Also present shortly about gut therapy, what that means. And lastly, I want to kind of link together about digestions, how this is related to metabolic and endocrine health on that one here. And then we'll do a case, and then we'll open the forum for question and answer. Okay, let's go to the next slide. Thank you. So when I say conventional, that means, our mainstream's medical model, where we take a very detailed medical history, understanding the problem, what people are complaining about, and doing physical exams, and order any labs, imagings, and Chinese medicine would use a pulse diagnosis, the most powerful way of analyzing a problem in your clinic. And then you arrive a diagnosis, a working diagnosis, start treating the patient, see how things are going on it, verify with some objective, and go from there. This is kind of, pretty much a majority practitioner chosen to do. The problem is the following. That's what I learned is it's kind of narrow-minded because we basically funnel through from a huge pool of information down to a couple relevant informations and make a diagnosis out of it. And a lot of the time we're using really for rule out a diagnosis by exclusions rather than actually knowing what's going on. And then the treatments focus heavily on medication and procedure. That's more like Western medicine. In our world, it's more like nutraceutical, diet, and herbal medicine on that as well. And then the engineering medical model that I actually been implementing and been using for the past 12 years is expand the subjective by focus on defining parameter and a condition related to what the chief complaints the patient's coming all about. That's really the key part of it. Basically, if you imagine the center of a circle, it's the problem, the chief complaint from the patient. And you can draw an infinite circle, depends on the diameter, how big you want it to go, right? And how narrow you want it to go. Well, we don't know what the diameter is. So what if I let's assume the diameter, the width of the depth of the problem to, not yet, sorry, the diameter of the complexity, the width of the problem, it's such and such. We have to make a working hypothesis. So I will not use the word on a presumable diagnosis because we don't even know what we're dealing with until we get more information. So we have a hypothesis based on the information patients give to us, or based on other medical information from other specialty. We kind of take a look at, we'll put the puzzles together. And in order to do that, there are criteria. We need to be open-minded. We're mostly using the diagnosis to rule them in, not to rule them out. And how we can do that? Well, it's going to be really different history we're taking on it. The birth history, which a lot of people do not ask anything about that. And mental history, some do, some don't. Environmental exposure, hardly anyone that I know in my colleagues are asking that. Toxicity, past infection, allergy reactions, or any kind of surgical procedure on that. And I would kind of highlight that when we did the case together to tell you why we need this information to become critical on that part. Lastly, the treatment focus is on the root of the problem. And we're focusing heavily on the detoxification process and trying to get a therapy or treatment plans to achieve a homeostasis. We're not going to provide a single solution to the person. This is your pill, take it, you'll be fine. That's not the end of the world there. It's a lot of them have a very convoluted problem. We need to define the parameter and then narrow down the few choices and develop a treatment plan that they have able to balance themselves, whether that is including to giving some herbal therapy, send it to a therapist, and maybe doing some acupunctures or craniosacral or laser therapy, all of that. We need to combine it together. The whole point is to get people back to homeostasis. Next slide. Thank you. So let's talk a little bit briefly about the embryology of the gut. So basically, it's the gut is actually developed in the 3rd to 4th week in the embryo stage. It's undergoing a folding procedure, meaning that it's imagine you have a piece of paper, you roll it up, become a pipe. The pipe is got bending over here and there, either by doing up and down, side to side, and then every time when you squeeze an action of a torque, there's an organ form such as a esophagus, the stomach, the pancreas, and the intestines, and the liver, and so forth on that. So that's how it forms, and it's the lining and the wall. It's actually dictate the location of the upper and the middle and the lower GI. So, and however, just by knowing that, we need to know that, hey, gut is not a single entity. It's coming from an embryo. It's a tube. It's a huge connection to the brain. And while one of the cranial nerve core, cranial nerve 10, which is the vagus nerve, and then connected to the nervous system in the belly, which is, we'll call it enteric nervous system. So a lot of people talk about, your gut is your brain. Well, that's exactly what it means. Basically, it goes through a vagus nerve and an enteric nervous system, a network plugged into the brain. So when we have an example, we don't feel well because we have a grief situation on it, my appetite's going to go down, and I'm not going to focus on eating. Instead, I'm focusing on healing my emotions. So your digestive system will go down. How could that happen? Well, because you got nervous system tied into the brain will work with the gut and trying to get to a comfort level that your body can function at that point on that. So we're going to go to the next slide. So remember the brain and the gut connections. Now, the next, I want to elaborate more about the digestive part and the emotional part and the chi connections on that. So the digestive system is actually a reservoir of energy generator. Just imagine we're eating food, we're burning calorie, we're converting calorie to molecule and storing the cell, and for immediate use or for future use. That's kind of what we do. So that's why we need to eat on that part. Well, if we have anything weaken the digestive process, we're not going to feel well, right? We're going to feel tired. That's the first thing we'll do. We're going to feel symptoms on bloating in the belly. So those typically what happen. And related to the Chinese medicine, of course, the first gate for digestion is your spleen and stomach, and that dictate how much you can digest and convert and store the nutritions or the micronutrients and the macronutrients on that. Another example is when we stressed out, when we get angry, well, it's impacting the liver qi, and it's lead to a stagnancy and put a halt on that digestive process. People with IBS has a lot of that. So in the history taking, we'll have to kind of pay attention on adjust the emotional state on the body. Well, we don't want to ignore it simply because this is the GI problem. We need to know why you're not feeling well. Is there an emotional component we need to take into account? So and that is very a powerful thinking process when you want to make your treatment plan to be more potent, and we got to keep that in mind there. And the other thing is gut is also considered as a second brain, as we talked about in the previous slide from embryology, the vagus nerve and the enteric nervous system connecting together here. So we got to keep that in mind when we treat a mental health problem and versus a gut problem. We cannot really separate between the two. So we have to kind of work those together. Okay, let's move on to the next slide. Okay, this diagram I just is a copy from one of my textbooks, and it's kind of give us an idea about what is a anti-inflammatory and a pro-inflammatory state in the gut itself. You can see on the right side of the diagram, it did show that the one with the arrow that's actually is inside the gut. It's all the food substances and going in there, and then past the cell lining layer, then we get into the body fluid and blood vessel and the circulatory systems in there. So on the left side, it's really showing that our lifestyle dictate how well our gut health is going to stay. The right side dictate what our lifestyle will produce a stress in the digestive system, and the microbiome will act on a different direction. That's why red means angry, right? On that part. And the producing some of the consequence, which is these are the particles such as like LPS, lipopolysaccharide. Those are very pro-inflammatory on that. So I do have a frequently asked question by a practitioner about, what's the big deal about that? And should I just test people for allergy rather than working for the gut? Because that patient has a multiple allergy for food. Well, it's a chicken and egg situation. Do you think the allergy is caused by the food allergen or caused by the gut? Okay. Oh, and then vice versa is, do you think the gut problem is caused by the food itself or by the bacteria? We don't have an answer for you. I'm sorry. But however, you can use the engineering mind to dissect the problem. The history of the patient will tell you which way to go. Should I go with the allergy testing first, or should I go with a gut microbiome, or I go straight to do a treatment and a diet? So we talk about that at the end of the two slide, kind of put that together. So that's kind of basically showing you how the maps are, and there are huge consequences when the gut is pro-inflammatory. Well, because the tight junctions on the gut, as all of you familiar with, will produce a leak. We call the leak meaning that there are food substances or a byproduct from a microbiome. We go through that tight junctions and you produce an immunological response, whether that is a allergy or a type 4 hypersensitivity, which is like different type of allergic response. One go to become an autoimmune problem, one just give you a stomach ache and all that, or give you a hive on that part here. It really depends on the state of the health, how much leaky gut you have, and how long is the problem for. So, and I can say that an IBS person can eventually are likely to develop IBD, irritable bowel disease, such as Crohn's disease and ulcerative colitis. It's likely, okay? There's also likely to develop a metabolic disorder on their own, on that part. So go to next page. Thank you. And then this kind of gives you a little highlight on how metabolic intestinal gut dysbiosis and then the lifestyle and physical activity and effect will impact each other. Well, I mean, with the world now, we talk about a lot of people with obesity, type 2 diabetes, a fatty liver. I mean, to me, it doesn't really matter how you call them. They're kind of related together. And the key is the center point. We have to figure out what gut problem we're dealing with. If we can actually get a better gut, a lot of these metabolic problems will be better managed. And most of the time, we're able to get into resolution as well on that part. So an example is the diet that we on. We need to make sure our human populations are aware of the value of various dietary fiber. The fiber are extremely important. And then the microbiome, the probiotics, what you're getting into. Is it a specific one? Is it any brand that we're going in? We'll talk about that in the case later. The prebiotics, the one that feeds the bacteria, the good bacteria, to continue to survive and replicate. And then these short-chain fatty acid, polyphenol, and spices, those ones help to contain the bad bacteria, help also to eradicate some of the inflammatory response as well. Okay, and we're gonna go down next. Okay, so I do want to kind of just spend a little time on talk about what's gut therapy. There's a lot of definition. There's a lot of terms people were interchanging using this and that. It's all about definition, but it's kind of important to know. So in the world of wellness, one of the most important factor that, at least from my knowledge, American culture ignore is fermented food. We don't have a lot of availability of fermented food. You can buy them in the grocery store and the health food store, but I ask my patient, pretty much 9 out of 10 do not eat fermented food in their diet. They probably will go out, have a sandwich with sauerkraut and maybe a pickle when they go to salad bar. That's what they do. As far as asking them, do you buy this, eat this at home? They probably not. And I ask people, do you even know what kimchi is? They know. I think people in California completely aware because of the geographical location. I do seminar, I do talk to people in Wisconsin. They have no idea what those are on that part. So they probably unlikely we're going to eat that stuff on that part. So fermented food are really a drop-in solution for a good mixture of microbiome and prebiotics and probiotics. This is way more strong and potent than taking a supplement alone. So I think I still rank that as a number one on that. The other one we should be aware of, prebiotic substrate like a fiber, a soluble fiber, an insoluble fiber that allow the bacteria to able to grow on top of them. And then the live beneficial bacteria, it's important. We need to continue to feed the gut with good bacteria from food, and then they can grow on the substrate, which is the fiber, and become a symbiosis in that manner. The other one is a really new term called postbiotic. It's really it's not really a microorganism, but it's really a substrate, another substrate that help accelerate the growth of a good bacteria and producing organic acid that's anti-inflammatory in our gut. That's kind of important. And there's some supplement arising on this new market as well. Symbiotic is basically a repackaging form of prebiotics and probiotics, plus they add a well-known inulin fiber to make it more potent. To me, it's pretty much like a repackaged form of prebiotic probiotics. The last term is there's a term called psychobiotic now. It's really a strand specific to influence the brain and bacteria connection by clinical study. So those another one will be kind of handy if you want to deal with the patient who has mental health issues along with the gut. That's something you should look for and maybe do a a GI map to find out, what composition they have and what dysbiosis they have before you put them on this as well. On that. So that's kind of, I give you an idea what those are. The picture just kind of show you, what these other things will be beneficial to the gut, eventually to the brain. We'll go on to the next page. Okay, I'd like to focus more on the case now on that. This is the actual case with one of my patients, and I asked for permission. She says okay to present that. So I have a 65-year-old female complaining about chronic fatigue. Very common in my population, in my clinic, joint pains everywhere. I mean, got arthritis, and the primary doctor, the specialist, they all said that this is what you have. You got to live with it. Well, she's a very motivated patient. She already do her own diligence. She's on gluten-free, dairy-free. She knows she's allergic to seafood and nightshade. She completely eliminated these for years. She's not getting results on that. So, and here's what she have. Conventionally, she's being worked up by the primary care doctor and the specialist, and she's given a diagnosis of pre-diabetes, hypothyroidism, and a non-alcohol fatty liver disease. She does have anxiety and depressive disorder. So every doctor that she visited for, eventually she got one medication or more. She eventually got 4 medications to treat every single medical problem. And she wasn't happy about that, but she stuck with it. And then looking her lab that's done by other doctor, I realized, they're right. The liver enzyme elevated more than normal on that one. The AST, ALT, the 2 enzymes commonly located in your CAM12, CAM14 chemistry, it shows it's elevated. A normal number is less than 25, and they're 50 and 55. It's definitely elevated, inflamed liver, call it that way. And then her fasting sugar is 115. Typically, we want to get it about 99. So we know she's a little bit high sugar there, fasting. Her hemoglobin A1C, she's in the less than 6.15. It's greater than 5.7. So the doctor like to label her pre-diabetes. Okay, fine. And then her thyroid is a little bit underactive, but not quite to have called a full-blown hypothyroid on that. Well, they give her medicines anyway, based on the number. And they also do a screening test to look at, well, do you really have depression and anxiety? They did a scale on a subjective study. She got a score of PH29 at 14. That's a moderate depression on that part. So she stuck with the objective, and the medicine that being justified, and she's taking it. She's still not doing good. I can't sleep, and I'm waking up a lot, go to pee on that part. So she's concerned, and this is kind of the patient I'm getting. If you go to the next slide. So once I get the patients, what can I do to help them? Well, I'm not going to reorder the lab from the other doctor that's done. The work has been done, and clearly my patient is not getting an answer that she wants. She said that I'm not feeling well. Well, the doctor really say that, the medical doctor, I really cannot do anything beyond that. I think you just need to kind of live with what you have on that part here. And when I first got the case, I started, let's go ahead and do a detailed history. What I found is she has a history of environmental mold exposure, and her home is currently under remediation. Well, Dr. To, why does it matter? I mean, she has all other problems. It's more going to be a problem for that one. Well, I'm going to tell you later on that. And she also mentioned about, I have a lot of seasonal allergy. I'm taking a lot of antihistamine, like, Allegra, Benadryl, Claritin. I'm not getting relief. I'm always going to get a hit on that one here. Well, what the patient is telling you is, I'm very sensitive. My immune system is overdrive. Why? Well, I got more exposure. So my immune system are kind of presensitized to everything. Of course, I'm going to get very reactive on allergy. So we need to keep thinking a perspective that, the immunology, we need to work on that. I mean, the other doctor wasn't really care about this. Let's work on that. Okay, so it's immunology workup that's identified. One, well, let's do some exams. Well, they're not even touching the patient these days. If you realize when you go to see a Western medicine doctor, and so I go ahead to do a pulse diagnosis, find out that the spleen and stomach is really not up to speed. Okay, it's very, very sluggish gut, and very, very a lot of gas trapping on the exam. And then on the pulse is also showing spleen and stomach. It's one of the couple of problems. The tongue exam showing that has likely a liver and kidney issues on that. So, okay, before I jump to given herbal formula treatments and all that, let's do a lab, figure out, let's see what I'm dealing with. Well, I did an immunology panel. It turns out that lady is having a very reactive immune system. The number is called complement C4A, which is an index of how active your immune system are. A normal number should be less than 1,000. She got 15,000. Well, because she told me she got mole exposure, let's test her antibody or her mole antibody, one type of them. A normal number should be less than 25. She got an IgG of Aspergillosis fumigatus, 180. So considered quite high. She's very reactive. Her immune system thinks she gets getting under mole attack 24/7 on that. Her glutathione level and the blood level serum is very low. A normal number should be about 345, and she's at 150. Her insulin level at fasting is 25. She has a huge insulin resistance. If you look at those numbers, you can pretty much can label her back where the original doctor saying, she's pre-diabetic. She's pretty much like insulin resistance, and she has overactive immune systems. We do know that, and she's very inflamed. Well, we do know that too. So the labs kind of confirm what we need to do. So we have a hypothesis now. Most likely, the mole exposure was one of the trigger. She does have a long, history of allergy. So if I can do anything to help to suppress, manage the overactive immune system, I think she will feel better and she can sleep too on that part. Well, don't forget about the gut. And she's complaining about tired and my exam was having some GI issues on that. So I go ahead to do some formula for the stomach and spleen. So I chose health concerns, a corpus purse fire, and I did a matching on my pulse, and it's a match. And then I also give a gentle center as needed for emptying the bowel on that. And then we'll also give a fat soluble binder called Z binder supplement to bind the mole antibody out. And we'll also ask her to do some glutathione injection because she has a low glutathione weekly and she's inflamed. So I asked her and discussed the risks and benefit doing a GLP-1 injection. She's open-minded to it, and plus she's pre-diabetic, and she's doing that injection weekly. I monitor all the side effects with her, and she's also all up to doing an anti-inflammatory diet. After months of therapy, she actually feel near resolutions of all her symptoms, and she's able to be a normal person. And she lost 20 pounds, and all her labs and imaging that's done by the other doctor, when I asked the primary and the specialist to help out, it's back to normal. So I start working with her to wean off the medication. And as this 2 weeks ago, I saw her, she's not on any more medication anymore. She can play and control in her health. She really appreciates the critical thinking process we provide and looking at this different angle. And she's a happy girl. And next slide. So I'm kind of open to question and answer for you guys. I know this is kind of short presentation, but I want to kind of condense a case, present a few, knowledge on the GI, the brain, the immune system, the digestive process, how these are all related together.
Okay, so we're just having a little Q&A. So anyone who has a question, you can use the chat. We also have the Q&A itself.
I have a question, Dr. To. So
Yes.
in the case study that you presented, you said part of the treatment plan was glutathione injection weekly. What was the reasoning behind that? Is that just for the antioxidant properties, or what was your reasoning behind the glutathione injection?
That's a great question. So as we are aware from microbiology, your mitochondria It's a powerhouse of the glutathione. It's very potent antioxidant. When a patient's under a mold toxicity, which is the hypothesis are, it's very difficult to eliminate these stubborn immunological particles. The glutathione seems to be a very potent chemistry, allows a faster recovery. And since the GI absorption on glutathione by a pill, it's very poor. So an IV or an injectable is highly recommended. And besides, the level can be monitored as well with the blood work. So I feel this is completely legit just to initiate the therapy and monitor with the blood and subjectively with the patients.
So you preferred the injection over the inhaled like nebulizer because of her exposure to mold. You opted for the injection instead of the nebulized thing to help clear out the lungs and the.
No, that's a good point. So that's become pharmacology. The point of delivery system, it's critical. At her level, I didn't present yellow lab. She's not having an attack on respiratory. She's more on the B lymphocyte memory cell was being elevated. So her body was thinking about she's under an attack. In fact, she has no more exposures anymore. Home has been remediated, and she's have no respiratory symptoms besides a seasonal allergy. So the choice of doing an injectable is probably more applicable. It's more appropriate. Mm-hmm.
We have a question in the Q&A from Ted. And it was, if glutathione is a hormone, can the body reduce production of glutathione has a negative feedback loop? And what about liposomal glutathione?
That's, again, it's go back to the pharmacology. Liposomal, it's allow a better absorption in GI. If you look at this published study, liposomal compared to intravenous, there's still a discrepancy about 35% of going in. So it depends on the severity of the patient. If your patient has a very severe and immediate problem, probably IV injectable is recommended. If people have a mild and moderate, I think liposomal is great, or nebulizing if you have a respiratory problem.
Ted had a follow-up question. What panels do you commonly run and from what labs?
Oh, well, those, actually all the lab I listed on the case, you can actually order that through your commercial lab, Quest and LabCorp. It doesn't require specialty lab. So for all your patients who have access to the insurance, if you code correctly, it's all being covered.
I'm looking to see if there are any other questions. Doesn't look like we do. Thank you, Ted, for your questions. Actually, oops, sorry. Oh, he just says thank you. Okay. I had another question. Can you speak more on you were talking about when you had the slide on gut therapies, you were actually talking about the kind of the new term of the psychobiotic, right?
Right.
I understand that that's the probiotics that's going to help eventually affect the brain, right? But how so? Like, how do you what are the manufacturers of those saying or like marketing it to practitioners or to patients? What are they actually saying about that?
Well, typically these kind of a class of the probiotics, they have a particular clinical strand or collection of strand that actually have done study in monitoring subjective and objective findings with the patients in the brain on that. So that's you talk to your supplement representative, they have clinical study to do that. Well, should I believe on them? Probably not, but I think will be something we should think about this as available. But if you do a reverse engineering perspective, you did do a lot of study digging on it, looking at the microbiome, like doing a GI map study on patients who has mental health issue. I'm particularly interested in people with schizophrenia. It's a lot being talked about, they have a bad gut and causing the symptoms and being psychosis on that. The bunch of study in the NIH identifies strands related on higher population on an invasive strands, and a lower population on the beneficial strand bacteria in the gut. So that's give you a lead about, that gut dysbiosis or mental health. It has some relationship. So in case like this, I recommend people don't give them the supplement right away. Check on order a gut test, do a stool study, find out exactly what you're dealing with on that part. And then you can precisely control the situation and develop a better treatment plans than just selling them as supplements.
So when you say do a stool test, is there a lab that you prefer? Do you work with all of them? Like Genova has their GI Effects comprehensive stool. I think Diagnostic Solutions has their GI map or whatever. So
GI map.
GI
I'm
map.
predominantly using GI map because of the history that I have built up with them, and they're able to pretty comprehensively give me enough information to work with a given problem on that. So the accuracy is pretty good with them here.
My other question is going back to the glutathione injection. So in California, acupuncture, we can't do injections. How do we go about getting, like for me, I can do it because I'm dually licensed as a naturopathic doctor, but for
Right.
other acupuncturists in California, they can't do injections. So how do we go about, or how do they go about getting the injection for their patients, or like how do you recommend we like get a DO or MD to help us with that? Like
How about does California has access to medical spa that actually people provide glutathione and IV drips?
They do, yeah, some do.
So that might be another access. You can just kind of prescribe that to the patients to do that weekly on top of actually with the liposomal. I think those would be the best recommendation. I mean, if I did a study a while ago comparing people, I sent people out to do a weekly glutathione, 50 milligrams IV push weekly, and look at their glutathione level and also their toxicity in the body. Actually doing a 3 times injection like every other day per week versus an IV, the injections 3 times a week is almost double the effect of an IV. So injectable is still more superior if we can do that. But if not, the liposomal plus the IV, it's another avenue that you can use.
Great. Does anybody have any other questions? Don't be shy. I know I'm asking a lot of questions, but everyone understood Dr. Toe's. Oh, wait, let's see. Ted asked, how long does the glutathione level stay corrected?
Oh, level-wise, that's a great question. It depends on the toxicity on the body because it's being consumed. So we don't really have a set value there. So, but as far as, let's say it's not being consumed, if you inject it to the body under a normal body conditions, it lasts about 3.5 days, what you give them to the patient. But if the patient has high toxicity, it probably will be able to diminish that level within 24 hours. That's why I said that every other day will be a good idea just to do injection for people who are severe. For mild and moderate, you do not need that frequent.
So my own curiosity, what's the milligrams of this glutathione that you're injecting?
It's 25 milligrams per injections. It's recommended. For IV, it's 50 milligrams.
Do we have any other questions about the gut-brain connection, therapies? All right, Ted has another question. Are you only using glutathione to offset inflammation or toxicity, or do you ever recommend it as a daily preventative supplement?
Okay, I don't recommend that as a daily supplement. I think Ted early on, maybe you, Dr. Olive, you mentioned about a negative feedback. So it makes a lot of sense. We don't want to take this product on daily without a purpose because your body is able to regenerate and produce glutathione. If we start taking that as like a daily vitamin, your body might not be able to produce when you have a problem. So I don't recommend that as a supplement. We have to have a purpose when we do a detox.
What about doing the precursors to glutathione, the NAC, the N-acetylcysteine, as a daily supplement?
That's completely safe. The precursor will level out on its own. It will not impact the negative feedback on the biochemistry. That's excellent idea. In fact, I use a lot of when I design a every 6 months detox for my patient for wellness, and for those who has high bilirubin in the bloodstreams, I frequently use NAC to help them to have more pumps of bile juice into the gut. And everybody were feeling a lot of energy after we do that. And the bilirubin level will drop significantly along with the diet. So that's a very good choice. I never do an L-glutathione or glutathione supplement for a non-purpose detox, if it makes sense to you. Mm-hmm.
Awesome. Do we have any other questions? If not, we will give you back an hour of your time.
Well,
Any closing remarks, Dr. Toe?
yes, I definitely enjoy presenting this to everybody else. And as you can see, the world is changing. We have as a dynamic world. We're dealing with our different colleagues in different profession in the medical world. So I think as long as we presenting with the logics and facts, we would gain respect from other community. That's how I feel that. So always based on the science. That's number one. And number two, it's always think about a purpose when we do a treatment plans. What are we doing? Why are we doing? And all that. And always take a good history. It I give you a little quick example on the birth history. I have a teenager with digestive health problem. She always break out with viral sores in the body, either a chasion or sty or a fever blister on that. Very common on that one here. And I did a detailed history. It turns out that she has a swallowing problem when she was born on that part. Where you say, why does it matter with these kind of stuff? Well, if a person who has a swallowing problem at birth telling you that she has a birth trauma, her adrenalines, her vagal tone is very high. And they were always under stress when they grow up. So they always suppress the immune system. Turns out that teenager has got lots of infections when she was childhood, either getting strep, a UTI, an upper respiratory, always given a medical therapy by the insurance doctor, antibiotics, right, to do that. Well, guess what happened there? They got to start eroding the gut. But you and I would think, well, on the front end, as a natural practitioner, let's do some gut health and protect the patients there. Well, without that piece of information about birth history, we don't know her adrenaline was really high. Why don't we do some acupuncture and maybe cranial, trying to down the vagal tone while you were doing your gut health? Your success is highly enhanced by doing that. So that's it's the little thing that we miss. We're focusing too much on the diagnosis and the chief complaint without getting a history. That's an example of telling you we should listen to the patient, ask everything you have, find a relation that's relevant to your treatment plans, and it can make everything stronger or be ideal. And compared to the patient who doesn't have birth trauma, no stress, everything was like simple, straightforward, they probably don't need acupuncture at that moment there. It might be more like afterwards here. So I'm trying to kind of give you a lead about the engineering mind thinking when to do what, and then in that way we can maximize our time and see more patients and make more profit, of course, right? But at the same time, it's like they're happy. And the last thing I do want to mention is I'm sure you guys all know, but I talked to a lot of the residents and the young doctor mentor them in Florida. It's they forgot that either your acupuncturists, physicians, a chiropractic physicians, a naturopath, a DOMD. To me, it doesn't matter. We're all going to help people. The problem is we forgot we're not a doctor only. we are the service agent and provider. We provide service to the patients, and that means we make sure give excellent service to them, and basically give them some time, listen to them, what they say, and then and understand their needs. Don't give them too much and overwhelm them to do, and um, run the simple treatment plans and revise it over time. And because I do see when I have received patients from multiple naturopaths, multiple visit with Mayo and Cleveland Clinic, what they come back is they bring a suitcase of supplement. I'm telling you, it's more than 100. And I asked them, how can you even swallow 100 pills, assuming you take 1 pill a day? I really don't know, but I want to get well. And so that is something we don't want to do. We want to try to simplify their treatment plans, make everything effective, make them happy, and then your referral is going to come from them, and then your business is going to boom.
Thank you, Dr. Ho. That was great. If you want, we can give you Dr. Ho's email and contact information for further discussion, further questions that you may have of him. If you haven't thought of the question yet and it comes to you later, that's great. Dr. Ho, can we make your PowerPoint available as a handout to our attendees? Is that possible? Thank you so much. And with Dr. To's talking about making time efficiently, because we are at 8 o'clock, I would encourage you to, all of you, to take this time right now to write your California representative, especially the business and professions, so that we can oppose AB 2497, which is the PT bill that they are asking to be able to do dry needling under the pretense of tissue penetration. And we all know we are the experts, right, at dry needling, at acupuncture. It's the same thing. Okay, so we are the experts. So please take this time to contact your legislature, especially the Business and Professions Committee. Write that letter. We have the template for you. Kim put the link in the app there. Dr. To, if you could write for us too. It doesn't matter. Get all your colleagues, all the acupuncturists from all different states in so that we can combat this. This would be great. Also, we have, if you are in the Sacramento area or the neighboring area, Tuesday, the 21st, this bill is going to be heard in the Business and Professions Committee hearing. We need as many people to come up there as possible so that they can say, I oppose this bill, and here's why, because it basically threatens patient safety and public safety, right? Because we are the experts. We have over 3,000 hours of training on how to needle, and PTs do not. So please do that. Kim, any last minute words?
No, just check your emails for the link. If you did sign up for CEUs, then you will get an email that brings you to the certification, and that will be sent to you once you complete that.
Okay. Also, we have 2 in-person conferences coming up. The first one is in a couple of weeks, May 1st and 2nd. That is a Friday, Saturday at Yosan University. So all my LA peeps, right, or the surrounding areas, San Diego, all the fun cities down in Southern California, come join, hang out with me. Let's do this, right? We've got a great lineup of speakers, right? And you might get a t-shirt, right, Kim? Maybe, possibly. Maybe a t-shirt. If you haven't gotten, we have some from our old one. It's really cool. It says California Acupuncture on it, right? We also have our monthly webinars, the second Tuesday of every month. Thank you, Dr. To, for being here for this one. We have them all scheduled out to 2026. And if you do all the webinars and come to all of our conferences, you will have enough CEs to renew your license for California. How awesome is that, right? So we want to do all of that. I don't have anything else. So everyone have a good night. Thank you for joining us, and we'll see you next month.
Thank you, everyone.
Thank you.
Hi, Dr. To. Thank you
Bye
so much.
bye. Good night.
Good night.